you. I need to say that because once the screen's shared, I can see about 4 people on my screen, but I know that there's far more of them. So we'll play your recording, Andrea, and then we'll be over to you for questions.
Hi, my name's Andrea Roberts. I'm an advanced clinical practitioner with a nursing background, and I work with the Central Community Crisis Response Team for MFT and MLCO. My poster is about breaking down barriers of vulnerability with research to inform clinical practice, and will highlight the journey through my internship. First of all, it's about starting with an idea, formulating questions to identify gaps in service, but also within my own learning needs. What are the missing links in service, and what do I feel isn't working for me? Where do I even start with this, and how do I bring my ideas to fruition? My academic area of interest is admission avoidance. Having worked in the emergency department, I was very aware of patients being admitted that could and perhaps should have had their care delivered at home. This prompted my move to the crisis response team, whose ethos is to care for patients within their usual residence. Doing some preliminary work, it is evident that attendances to the emergency department are increasing. This, alongside widespread reduced hospital bed capacity, leads to increased wait times and negatively impacts the day-to-day running of emergency departments and also ambulance services. This indirectly exposes patients to poor care, leaving them vulnerable. Just for emergencies, not just for emergencies, but also for planned activities. I looked at the drivers for change, the NHS initiatives for Home First, with the integrity of MFT's trust, values and visions of patient-centred care, and understanding that admission avoidance can improve patient outcomes whilst financially benefiting the trust. So I had all the background information. It's just, how was I going to get my ideas into something that can address this into clinical practice? I struggle massively with imposter syndrome, and I often doubt my deservedness and my abilities. But I also recognise that I am an individual, and that identifying this does make me vulnerable. Accepting that I don't know everything, and it doesn't make me weak. I can question ideas, knowledge and beliefs of others, because I'm trying to expose myself to learning and new things. That's what led me to look for something that could help me with my research, to help get my ideas into clinical practice. As a complete novice, I applied for the internship without much understanding, to be honest, but with a thirst to learn and grow. I am partnered with the Organising Care Theme, whose focus is to evidence and inform planning and delivering of integrated health and care services, which really fits my academic area of interest. My supervisors, Will and Faye, have been absolutely amazing throughout the entire year, being pivotal in all my accomplishments and being there to listen when I've had a moan and having meltdowns. One of the accomplishments was an MRES module in research design, which led me to developing a research proposal and utilised a predetermined grant application, which then became a pilot development. The pilot came from an opportunity to transform a rapid response service, which was currently focusing on inpatient reviews. The pilot put a community ACP as a single point of access within the emergency department, and this was to facilitate early discharge, to integrate primary and secondary care working, but also to navigate both IT systems. The aim was to analyse the introduction of the hospital emergency department-based rapid response service, while my objectives were to explore the impacts of the rapid response service on outcomes relevant to patients and providers, which included facilitated ED discharges. The outcomes from the pilot are proving positive, and my work will hopefully evolve into a PhD proposal. With the support and encouragement of my supervisor, I was also able to submit my study to several conferences, and I was chosen to speak at the Health Education England National Conference for Advanced Practice. I also had a presentation with the Health Education England Northwest Advanced Practice, and I was also successful in having an e-poster chosen, which were all seemed to have been greatly received. The final aspect of my internship was preparing my pre-doctorate fellowship application, which was a lot of hard work, but with all the work and knowledge that I'd gained over the past year, it all actually fell into place. The opportunities that have arisen since doing the internship have been completely overwhelming. Again, I come back to that imposter syndrome, but being vulnerable gives me permission to be imperfect, and it opens the doors for questions and growth. Moving forward, I want to clinically embed my pilot into local practice and extend this to incorporate the virtual ward. Professionally, I want to start looking at clinical lead or nurse consultant posts to continue improving practice, but also trying to stay as clinical as possible. My primary focus over the next 2 years is going to be my pre-doctorate fellowship, where I will be looking to do a small-scale qualitative piece of work, evaluating patient outcomes with a literature review, and start prepping my application for a PhD, alongside doing a leadership course. Thank you for taking the time to listen and review my poster.
Thank you.
Some of the things off my poster that I'm missing, like that top left corner.
Yeah, maybe.
No,
but then that's what this showcase is about, Andrea. This is the first time that we've pulled together people to do posters, and sometimes it's good to get that example of how what's happened there. So don't worry about that, Andrea, at all. And I think I saw a question. So Russ is asking, after your successes, do you feel you have imposter syndrome, or does your vulnerability enhance your ability to learn? What a great question.
I think still both. Everything that's new, I still feel like that imposter syndrome where I don't know if I could do this, it's not for me. But then if I put things down on paper and think of the logical things that I can do to overcome that, it does make me vulnerable. But yeah, a bit of both. But I think that only makes it better, makes me learning better.
That's a great answer, thank you. And Penny's saying it's a really good description of your experience. I'm scrolling. I'm going to leave somebody else to scroll the chat to see if there are any questions for the broader group of interns, but I just wanted to do a summary and a reflection of the things that I have heard this morning as we move into just before our lunch break. Thank you so much for, and it's a considerable undertaking in the midst of everything that we have to juggle to do a poster, and I have absolutely loved hearing what people have achieved. And if I'm going to summarize it, in terms of the beginning of the internships, the phrases that I saw, the phrases that I heard and saw on the posters, that was imposter syndrome was mentioned more than once. Research vulnerability, that's a really interesting term. People talked about being in a new land, a new language, didn't feel that this was their very first chance of understanding what researchers do and what research is. And what I've seen in a shift in hearing the poster presentations is a move to the phrases that I'm hearing at the end of the internship is people saying, I can be an academic, it's feasible, I like research, I've produced research outputs, I'm now a published author, I'm a principal investigator on a trial coming forward. There's a huge amount of evidence that people have increased their skills and knowledge, but not only that, that's paying dividends in what they're being able to do. There's talk of an increased research confidence, which for me says something about I belong in this space, I belong with this group of people, and I want to take credit, or want to take an opportunity to thank all of those who are our intern supervisors on the call, and anybody who's listening to this who might be thinking that they'd like to be a supervisor. That's down to you. You've given people a recognition that they belong in this space, that they can be researchers, they can be academics, and they can start to think like researchers and produce research outputs. And that confidence and learning is down to you. So it's a huge thank you to the supervisors who've made that possible. Also, a thank you to my fellow colleagues in the capacity building team, because a number of people have talked about the peer-to-peer networks, which we run not only for interns, but also the supervisors are interns. So if you're thinking, and I noticed the supervisors range from existing PhD students who are acting as intern supervisors, research fellows, postdocs, professors, anybody who's a member of the ARC can, if they're interested in becoming a research intern, talk to Ross, myself, Penny. If you want to be a research intern supervisor, please let us know. The other things that I've seen as the benefits is the ability to identify gaps. I've written down identify gaps, and very often I think some of the conversations are the conversations of working in a very busy, frenetic environment where you're not necessarily able to take a step back, do a lot of thinking and working out where your gaps are, both your gaps from a learning point of view, but where the gaps are in the research. What's the next best question that we ask? What's the next thing that we need to be focusing on? But not only what's the next thing that we're being focused on, but what's the feasibility of doing that as well? We've also seen some really good examples of how well supported our interns have been in terms of patient-public involvement and engagement. And Anila, thank you so much for all that your team have done to support the interns. And I was only having a conversation yesterday with somebody who said, oh, I had a really clear research question. I thought it was going to be really important. And then I did my PPIE work and I realised that's not what patients want to know. I've got to rethink. It's so important for us to be able to creatively and regularly connect with the people who are going to be the beneficiaries of our research. So that's been a really important aspect. And also I noticed, Deborah, there was some talk about looking at how apps can be made accessible to a much more diverse audience, and there's hopefully a conversation that will be starting as a result of that with yourself and Anila. So that's my an umbrella summary of what I'm taking away from today. It's